Last year, the majority of our holiday traditions were pushed aside or scaled back. After living with the pandemic for nearly 2 years, we all want to gather with large groups of family and friends to celebrate the holidays. Yet, in the back of our minds, we wonder if it's safe to do so. Today, we welcome Amy Hodge from Roanoke City and Allegheny Health District's Community Health Department to talk to us about staying safe and healthy this holiday season. Good morning.
Good morning to you.
It's great to have you here. Thank you for being here. So it is so true. We all are kind of questioning, what should we do this holiday season? Because last holiday season, it was completely different in terms of what was safe and what was smart. Exactly. So let's start out with the basics. Should we continue to wear masks and why?
Exactly, we should. That was our first line of defense when this first happened.
Right.
The mask is tried and true. It's a winner, along with social distancing, along with washing our hands. Just doing that will stop the spread or slow down the spread. So as we go through the holidays, you can even wear a pretty mask.
Yeah.
Oh, I'm known for my beautiful mask.
A holiday mask.
You can have holiday
yes.
masks. You can bling it out.
Yeah.
You can do all kinds of things to make it fun.
Now, right now, we're not wearing masks, but the first thing that we asked one another was, are you vaccinated?
Yes.
And are you, you know, and there's questionnaires that people fill out to make sure, like temperature checks and things like that. But those things are still important to ask if you don't know who you're around during the holiday season.
And something that's important to ask is a serious question. To ask your family members. Sometimes it's easier to ask a stranger than it is a family member. So what I try to do, and just to be real honest, I ask my family members, have you been vaccinated? And if they say no, and I said, we'll just all keep our mask on.
That's right.
You know, and not be offensive.
Right.
But be understanding. And then I've tried to ask questions like, why? You have any questions? So, you know, it's a twofold win-win. It's a win-win.
That's smart. That's very smart and good use of your time. Tell us about the news release for 16 to 17-year-olds regarding to receive a booster.
Oh, yeah, that's good news.
Okay.
You know, we're in a time where everything, it seems like we have so much bad news. But the good news is that 16 and 17-year-olds can get a booster so that they can become fully vaccinated 6 months after having had their second shot. So that's good news for teenagers because we know young people are really being affected by this also.
So even if you are, let's say 15 and you got a booster this summer, you should not get a booster 6 months later. If you're 15. If
you're 15, that's right. See, if your ages from, it's the new thing just came out, you're 12 to your 16-year-olds. That came out that we could get vaccinated. But all of it has a 6-month window that you have to wait until your last vaccination to get your next vaccine, to get your booster.
Gotcha. All right. So good news for the 16 to 17-year-olds.
Yes, because they like to party.
I have a 16-year-old and they stay busy all the time.
Yes. I met your 16-year-old when she was 2.
Right, exactly. And she's still just as busy. All right. Now, with cases on the rise, are there any options for at-home COVID testing kits available in this area?
Oh, this is just so wonderful. I get excited about good news. Part of the good news is that you can go to your local library, go downtown to the library, and get you an at-home test kit. And it has all of the instructions with it. So all you have to do is go to the library and you can get your own at-home test kit for free. What about that? Isn't that great?
That's a great thing, because I know that sometimes the pharmacies sell them, and in some cases they are not cheap.
Exactly.
So that's incredible news. So that's at most all public libraries.
Most all public libraries.
Okay.
And we are asking other libraries, if they have not chosen to participate, would they choose to participate in this program? It is most helpful. Plus, the health department does wonderful, wonderful things. I work as a community health outreach coordinator. So my job is to make sure that the community gets the education that it needs so it can make good decisions.
Absolutely.
So one of the other good things that I'd like to tell you is that we have drive-through testing I want to say this correctly, every Tuesday from 3 to 5 at the Salem Civic Center. So you can just get drive-through testing. It doesn't cost you anything. And just go through and get that testing too. That's good news. The more information that we have, it helps to stop the spread.
Absolutely,
So,
absolutely.
So I'm excited that you can do drive-through, or you can just go to your library and get one.
Right.
Isn't that cool?
Well, yes, it's very comforting to know that there's resources available, because this time last year, if I think about this time last year, it was a struggle bus. People were trying to figure out, like, where can you get tested, and we didn't have vaccines, and so we're in a completely different place this time than last year, and hopefully folks are taking advantage of what's available in terms of the resources. Well, any other tips or pointers you want to share with us? We have a few seconds left before we say bye.
Just a few seconds. I want you to let the viewing audience know that they can go to Valley View Mall, into the Community Vaccination Center from 10 to 7:30, Monday through Saturday, and get a vaccination or booster or whatever it is they need. You can just walk right in and get that. And so that's really great news too.
Absolutely,
Yes.
absolutely. Well, you have been a delight. Thank you for such positivity to share with us this morning. I think it's good to know that we're in a different position and a better position this holiday season than we were holiday season 2020.
Just ask the questions.
That's
ask
it.
the right questions.
That's it. Thank you so much for your
right,
time.
thank you.